Welcome to EM Cases Rapid Reviews, where we review the take-home points from the EM Cases main episode podcasts so you can ace your exams and take stellar care of your patients.
Hello everyone, I'm Nick Claridge and welcome to another edition of Emergency Medicine Cases Rapid Review. Today we're going to give you a quick and easy stepwise approach to managing a super common ED presentation, alcohol withdrawal. There are 4 steps. First, we got to figure out who is actually in withdrawal, then quantify it with a standardized symptom-guided approach, next initiate specific treatments, and finally, we got to help them out with some specific advice. We've all been fooled before. The patient who comes in asking for a script of Valium, stating they have really bad withdrawal, and you're thinking, are they really in withdrawal? Are they still intoxicated? Are they just looking for benzos? How can we figure this out? Well, we all know the symptoms of withdrawal. We've all seen it. We've all read it in the textbook. Unfortunately, a lot of these are subjective, hard for us to measure or observe. But there is one thing our experts suggest is the best measure, the tremor. And then there's a few specific things about this tremor. 1, it's an intention tremor. That means you won't see it at rest. 2, it's constant. And 3, it doesn't fatigue. And here's a great tip. Hand the patient a glass of water and watch them drink from afar. If this is alcohol withdrawal, the tremor should get in their way. And here's something I never knew, that a tongue tremor is impossible to feign. Get them to stick out their tongue and have a quick peek. What else should we be thinking of when we see a patient in withdrawal? It is sometimes really hard to differentiate it from someone who is intoxicated. And we don't want to be giving these patients benzodiazepines. And this makes sense. They have very similar features, like the vital signs. They both can have tachycardia and hypertension. They can be sweaty or agitated. One way to tell the difference is slurred speech. This is not a feature of withdrawal. The other things to keep in mind are other causes of delirium. Look for signs of head injury and do a good neuro exam. They're at higher risk of intracranial hemorrhage, so have a low threshold to get them into the CT scanner. But they can also have infections, toxidromes like sympathometics, anticholinergics, and toxic alcohols. There's also serotonin syndrome and NMS. All of these make the list.